Hi everyone, welcome to Medicine or YouTube channel. In this video, we are going to see about hemophilia. Hemophilia is an inherited disorder which affects the male and transmitted by the female. It is an inherited disorder which affects the male and which is transmitted by the female. It is an X-linked recessive disorder caused by deficiency of factor VIII, and this type of hemophilia is called classic hemophilia. The hemophilia is an inherited disorder which affects the male and transmitted by the female, and it is an X-linked recessive disorder caused by deficiency of factor VIII, and this type of hemophilia is known as classic hemophilia. The another disorder of the hemophilia is B, or Christmas disease, which involves the male inherited or X-linked recessive trait. The another hemophilia is which is B, which is known as Christmas disease, involves the inherited or X-linked recessive trait, and it is caused by the deficiency of factor 9. First one is, it is an X-linked recessive disorder. Hemophilia generally comes from the genetic, from the parents to offspring, so that it is a genetic disorder which the males are always affected and the females are carriers. The X-linked disorder, recessive disorder caused by the deficiency of factor VIII, and this type of hemophilia is known as classic hemophilia or hemophilia A. And another type is hemophilia B, which is the factor 9 gets deficiency. The clinical features of this are, at the birth, the newborn hemophilia is usually healthy through the bleeding through the cord and hematometry occur. In infant, the hemophilia in infant at birth are normal, but the hemophilia in the infant is asymptomatic till 6 to 12 months. While brushing, it becomes obvious. During the childhood, it severely affects the individual. Spontaneous bleeding may occur in the joint and muscles. During childhood, there is severely affected individual. Spontaneous bleeding may occur in the joint and the muscles. In adult, the frequency of the spontaneous bleeding decreases and the joint is already have been damaged, so the intracranial hemorrhage may be life-threatening. In here, it is already damaged. The spontaneous bleeding causes already damage in the bones and the joints, so the intracranial hemorrhage is life-threatening. The investigations are APTT is prolonged in hemophilia A and B, but in prothrombin value is normal. The specific factor assay demonstrates reduced factor VIII in hemophilia A and the factor 9 in hemophilia B. If the clinical history is strongly suggestive of hemophilia, the normal APTT does not exclude the diagnosis. Treatment. It is done by the fresh blood transfusion and the bleeding is in large mass. The factor 7 concentrate employed case of hemophilia A and the factor 9 concentrate in the employed case of hemophilia B. Thus, blood transfusion is given when there is excessive large bleeding in this case, and the factor 8 is concentrated. Factor 8 is concentrated in the hemophilia A. The factor 9 is concentrated in the hemophilia B. The hemophilic will require a treatment before a dental. Any hemophilic patient should require a procedure before. Should require a treatment before the dental procedure. Such patients should be managed with IV infusion of cryoprecipitate or factor 8 combined with the aminocarpic acid 4 to 6 grams. Antibiotic is also given with that. The complications of the hemophilia are anemia due to excessive of bleeding, contractures in muscle following the intramuscular hepatoma, spontaneous intracranial hemorrhages in severe hemophilia. In severe hemophilia, there is spontaneous intracranial hemorrhage and contracture in muscles in intramuscular hematomas. These are the complications of the hemophilia. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe. Thank you.